to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Danielle Sweeney. She is a pediatric urologist, and she wrote the Kevin MD article, I Left Medicine, Then I Found Meaning. Danielle, welcome to the show.
Great. Thank you so much for having me.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. So I do not come from a family of physicians. In fact, I don't have anyone really in the sciences, but at a really young age, probably 10, 12, I kind of fell in love with the sciences, particularly biology. And so from that moment on, I had set my sights that I was going to be a physician. So I didn't really have any family pressure. It was all very much something that I was interested in, that I wanted to pursue. And I was pretty driven from that time, looking at colleges, specifically looking at, heavy science programs. After college, went straight to medical school. From there, went into urology, had discovered my love for surgery in medical school, and pursued a 6-year urology residency. So my path was pretty much, in my mind, set. I was driven from a young age. This is my life's work. This is what I wanted to do. And certainly when I got to that point, I was thrilled. I had sort of achieved these goals that I had set for myself at an early age. Following residency, I did a 2-year fellowship in pediatric urology, and then had taken a job in Austin, Texas, working as a pediatric urologist.
So tell me a little bit about your story. What happened next?
Well, I have to say, probably I had my first child towards the end of my residency before starting my fellowship. And I think prior to that, I was very happy with my career. I was very happy with my choices. I never second guessed it. Of course, it was lots of hard work, sacrifice, but really I was thrilled to be achieving these goals. I think after the birth of my first child, I began to feel a little stretched. I was struggling with the work family dynamic. I would say the first year of my daughter's life, I didn't see her very much. I was not present. I had very little to do with her upbringing. And I think that weighed on me pretty heavily. But, I had my path. I had my goals. This is what I wanted to achieve and push forward, did my fellowship. And then once I started practice, I think for the first few years, it was different. I was learning different skills. I was more autonomous. I was responsible for my own schedule. But after a few years, it started to feel different. I started to feel like I was a bit on the hamster wheel, so to speak, that every day you would wake up and it was, rushing and just trying to, be the perfect physician, be the perfect partner, be the perfect mother. And it kind of started to weigh on me a lot. And then I think medicine also was going through radical changes at the time. I think as, you start to get higher up in your career, your responsibilities changed. And it really became, in my opinion, less about patient care and sort of the meaningful part that I loved about medicine so much, and more about paperwork and meetings. And it just didn't seem to be, I wasn't finding the joy and the meaning as much. I then had my second child, and I think began to even feel more spread thin, certainly started feeling the effects of burnout. And my career, I dreaded going to work. I was dreading coming home because I just felt like I was failing in all aspects of my life. And I wasn't really able to perform at a level that I felt was where I should be. And certainly I think that was more internal pressure. I mean, I think if you ask people around me, they didn't necessarily notice any sort of performance drop off, either both in my personal life or my professional life, but it really was something that weighed very heavy on me. And certainly I think I, probably was hitting sky high on every burnout scale that there possibly could be.
And you talk more about that in your Kevin MD article. It's titled, I Left Medicine, Then I Found Meaning. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to share it?
Sure. So about 10 years into practice, I kind of came to, a crossroads. I realized that, I was heavily burned out. And I really, after talking to my husband and just kind of reevaluating where we were, I realized I needed to make a drastic change. I was terribly unhappy in my career. It was starting to boil over into my life. And I just came to the conclusion, I think when my older daughter was 10, I said, this is it. Like, I can't do this. I'm missing out too much. I'm going to leave. And I think as a physician, I think a lot of physicians feel this way. it's hard to make that break. It's not like you have a lot of other career choices you can just transition into. I was a minimally invasive pediatric urologist. I mean, that is a very niche specialty. So it's not that I didn't have any other skills that I could do, but I really felt that I was limited as to what I could do as a career. So I said, okay, well, I'm going to retire and I'm going to figure this out. So I made the choice at 42 to, leave my clinical practice. And from there, the first year, I think I dabbled in some consulting. I did some telemedicine. I was doing some peer-to-peer consulting, and I just wasn't finding anything that really stuck or really made me feel, fulfilled. I did some work with the University of Texas Dell Medical School with a humanities program with physicians in humanities, which I felt was wonderful and interesting. But again, it didn't feel like it wasn't giving me meaning. It wasn't giving me purpose. And at the suggestion of one of my previous bosses, one of my mentors, he said, you used to love to go on these surgical mission trips to low resource areas. I'm going to be going to Uganda. Why don't you come with me? I think this could be good for you. And we went, and it was such an amazing experience for me to rediscover that. I had been involved as a fellow and early in my career doing some mission work both in Central America and in Africa, but I hadn't done it for probably about 5 or 6 years. And that trip really just was such an eye opener to me. The type of medicine to practice there was really probably the most idealistic type of medicine where you were helping people. It really brought, I felt like there was actually meaning in the work that I was doing. And it was just so fulfilling that it was feeling that it filled that void that I was missing. And I realized it was like I had that aha moment that this is truly just I think if a lot of physicians experience that, again, it really brings back the meaning in medicine. And so that's kind of the crux of the article was we all become very disillusioned, but really there are meaningful ways to practice and there are some meaningful experiences that you can have that really bring the joy back into your career. And I was really fortunate, I think, to experience that.
So I want to talk about a little bit about that transition because I'm sure that a lot of physicians were in similar places like you were. They were burnt out, thinking about leaving their clinical practice and doing something fulfilling like you described. How difficult was it for you to make that transition? Did a lot of people have a negative reaction to that? Did they push back and ask you, why are you doing this?
I mean, of course. I mean, I think it's pretty rare for, a physician or surgeon to leave practice at 42. I mean, I did 6 years of residency, 2 years of fellowship, a lot of sacrifice. And then after 10 years, just to kind of hang that up, I think initially a lot of people's first impression was, oh, did something bad happen? Did were you involved in a malpractice suit? Or, is she having some mental health issues? And it really was none of that. I realized, I think, in some ways, I think a lot of physicians feel trapped. You put a lot of time into your training. There's a lot of financial sacrifice. Making a radical transition like that is hard on families. And so I feel like a lot of physicians do feel sort of trapped in that role that they think that they really can't leave. And I was fortunate enough in a situation where it was scary to take that leap, but I did. But I think it was a sort of a foreign concept for a lot of physicians to grasp. I do feel like I had a lot more come up to me in a very positive way and said, I'm really jealous. I wish I could leave, but I can't. That was really, brave of you to do that. I think a lot of people are miserable in their jobs right now, but they don't feel like they can leave. So I think there was more of a positive, but certainly I think there are questions, why would you quit at 42? And it's not the norm, but I hope that at least I'm showing that there are other options. If you're feeling burnt out, that you don't necessarily have to stay in your career.
Now, when you were disillusioned about medicine, was it that particular position that you were in, or did you try different positions and found that it was pretty much the same difficulties everywhere you went?
I didn't necessarily try different positions, but looking at, I certainly, we all have colleagues that have job hopped, thinking like, oh, I'm going to go to this place that's going to be better. And after years go by and then they leave again. And, and I considered taking a job in another city. But I realized that I wasn't really necessarily leaving for anything different. It's the system. I think the system is broken, and it's not necessarily going to be better or different. And I think the issues that were making me burned out are just universal in medicine. So going to a different city, sure, maybe for a year or two as you're building, it's exciting, and you're transitioning, and you're putting a lot of effort into that. But once you get into the routine of it, it's essentially the same. So for me, I knew that probably wasn't going to be the answer.
So tell me about what your life is like now doing medical missions. Where do
Yeah.
you go? How long do they last? What kind of cases do you see?
Sure. So I am the executive director of International Volunteers in Urology. And so this is a global surgery nonprofit that specifically focuses on the urologic equity gap that exists worldwide. So about 5 billion people lack access to surgical care. And for specialty care like urology, that number is even higher. And so what I think sets us apart, this organization apart from others, is that we don't just focus on healthcare, but we really focus on the training, the education, other healthcare providers, specifically urologists and general surgeons, that are going to be providing urology care to their own communities, so they don't have to rely on foreign entities coming in, or other doctors coming in to treat their community. So we really feel this is the most scalable and equitable way to treat the lack of access that exists. So for me personally, it hits upon lots of things that were very meaningful for me when I was practicing. So of course, the healthcare aspect of it is just tremendous.
Mhm.
But I always enjoyed teaching. I always enjoyed being with medical students and residents and sort of imparting these skills. And so this, a large part of what we do is training other physicians that don't have the access to the types of training education we have. So to me, that is like, I love that. So combining those two things together has just been extremely rewarding. And I feel like a lot of our volunteer surgeons that work with us as well feel the same way. A lot of them, we call them repeat offenders, because they come back and they'll do
Mhm.
like 2, 3, 4 trips a year. A lot of them are using a lot of their vacation time to do it, because they find that it is so much to their practice and so much to their life. And I'll be quite honest, I think a lot of our volunteers will verbalize this, that they feel burnout as well. And doing this type of medicine really kind of recenters them and connects them back to why they wanted to be a physician in the first place. So it's tremendous work, and it just really is very, very fulfilling.
Now, for those physicians who are listening to this podcast and listening to your story, what kind of questions should they ask themselves to see if they're suited to medical mission work?
Mhm. Well, I think first and foremost, you have to understand that the resources that are available in these other areas are not the same that you're used to. So I do think there has to be some degree of flexibility, and being able to operate and to practice in conditions that may not be ideal or suitable, that are suitable to what you're used to. So I think that first and foremost, you have to kind of go in understanding, like, you're not going to have the full instrument tray that you're used to, or maybe you're not going to have your choice of 10 different sutures. But I feel like for most people, getting back to basics is really, it's important. And again, I think it recenters them a little bit about pure medicine, and why they wanted, why they became physicians in the first place. But I think anybody who's interested in doing it, has, I think I think anybody who did this type of work would find it so meaningful, and really just, I would say, I think they would just, it would probably change the way they practice medicine, and
Mhm.
probably change the way they look at medicine.
Is there any additional training that's involved? Should a physician be interested in pursuing this?
Well, I mean, specifically for, our organizations, there's lots of different organizations out there. We work with urologists. Particularly, we have a lot of general urology programs. Particularly, our urology training is focused on the more subspecialty areas. So, for example, oncology, pediatrics, reconstruction. So for a lot of our volunteers, that's sort of their practice areas. But again, we have a lot of general urologists that, may not have been fellowship trained, or really, dial down and practice in one specific area. And we still, I mean, they go on these trips, and their knowledge is very, very important, and what they can offer is tremendous as well. So really, I feel like it's really something that's open to anybody.
And which parts of the world do you typically send physicians to for their medical missions?
Sure. Well, we have about 30 sites all over the world. I would say probably the biggest concentration is in sub-Saharan Africa.
Hmm.
So we have programs in Ghana, Senegal, Uganda, Rwanda, Burundi, Zambia, Kenya, Ethiopia. But we also have some in Asia. We have 3 sites: India, Mongolia, and Vietnam. We also have some sites in the Caribbean. So Trinidad, Haiti, Jamaica, and then also Honduras. So we really look to, we'll really go anywhere, but it's important for us to be able to partner with physicians who are eager to learn, that are eager to, that need mentorship and, really want to learn skills that they can impart to, their medical students, and really have that training. It just sort of amplifies it.
We're talking to Danielle Sweeney. She's a pediatric urologist, and she wrote a Kevin MD article, I Left Medicine, Then I Found Meaning. Danielle, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah. Well, I would say I think the best message is that, one, you don't always have to follow the path that you set forward for yourself. It's okay to deviate from that. I at a very young age had thought that I was on a specific path and that was just the way it was going to be. And when I realized it wasn't working for me, I think it's okay to shift gears and to try something different. I think that my life right now, my professional life has much more meaning, and I'm way more fulfilled than the original pathway that I anticipated. So yes, it seems scary to sometimes break away from, the mold that you set for your life, but I think overall you're going to be much happier if you pursue something that you truly enjoy.
And how can people reach you?
They can reach me at danielle.sweeney@ivumed.org, or also info@ivumed.org.
Danielle, thank you so much for sharing your story,
Yes.
time, and insight. And thanks again for being on the show.
Wonderful. Thank you, Kevin. Appreciate it.